Hello everyone, I am Dr. Arun Kumar Mishra and today I will talk about sleep apnea. Sleep apnea is a condition in which breathing stops and restarts during sleep. It is followed by a daytime sleepiness. The types of sleep apnea. It is obstructive sleep apnea, central sleep apnea and complex sleep apnea. Obstructive sleep apnea. This occurs due to the dilatation of the muscles at the back part of the throat. Though the upper airway does not contain any bone or cartilage, so the patency of the pharyngeal airway depends on the dilator muscles. Sleep apnea is the recurrence of occlusion of airway during sleep. The inspiration is followed by the negative pressure at the upper airway. During wakefulness, the patency of the upper airway depends on the contraction of the dilating muscles. But during sleep, the muscle tone declines, which impairs the ability of the muscles to maintain the patency of the airway. The combination of an anatomically narrow pharynx and the underactivity of the muscles causes occlusion of the airway. The reduced output, the muscular neural output when it goes down, and in the collapsible airway, the chances of occlusion of the airway is more. Due to the repeated occlusion of the airway or due to the apnea, the saturation of the air falls down, and this reduced saturation of oxygen, the brain senses it and rouses the person to re-establish his respiration. The other reasons which can cause the sleep apnea are the obstruction in the nose, which makes a gap between tongue and teeth. So during mouth breathing, the tongue is pushed backward and the chance of occlusion of airway is greater. The muscles of the pharynx, they also support the part of the pharynx like tonsil, uvula, the side walls of the pharynx. They all are supported by the muscles, and the relaxation of the muscle can also give a chance to occlude the airway. Fat deposition and the swelling of the part surrounding the pharynx has a greater chance to produce the occlusion. The incomplete obstruction of the airway causes the air turbulent flow, while the complete obstruction causes apnea or hypopnea. Symptoms of OSA: loud snoring, stoppage of breathing during sleep, gasping for air, awakening with a dry mouth, morning headache, difficulty staying asleep, insomnia, excessive daytime sleepiness, hypersomnia, difficulty paying attention while awake, irritability. The risk factors are excess weight. A fatty person has a greater chance to go into apnea. Older age, narrowed airway. If anatomically airway is narrowed, so that has a greater chance of production of apnea. Hypertension, chronic nasal congestion, smoking, diabetes, asthma and alcohol. Complications: daytime fatigue, drowsiness and irritability, high blood pressure and cardiac problems. In patients of the cardiac patient has a greater chance of going into death when the saturation of oxygen falls in the blood. And the decrease in oxygen saturation in such persons may also increase the blood pressure and can create stroke, cardiac problems, and atrial fibrillation. Type 2 diabetes. The decrease in the oxygen saturation also causes resistance of insulin. Metabolic syndrome, abnormal cholesterol level, complication with medication and surgery. Liver problem, abnormal results on liver function test. Investigation. Investigation is done on the basis of signs and symptoms. Examination of back of throat, mouth and nose for extra tissue or abnormalities. Test is done by polysomnography. Heart, lung and brain activity is monitored. Moderate sleep apnea is considered when there is 15 or more apnea per hour, where an apnea is defined as 10 seconds or longer. Now, treatment. The management is done on the basis of when the patient is obese or has all over fat in his body. He is advised to reduce his weight. Smoking prohibited, alcohol to stop, treat nasal allergies, and the patient is advised to not to sleep flat. He is said to sleep on his back, on his sides. The treatment of sleep apnea is done by CPAP device, continuous positive airway pressure device. So with this, the air saturation is maintained in his body. Surgery is also done in sleep apnea in the condition when the person has obstruction in the nose, like nasal polyp or deviated nasal septum, and for the enlargement of the tonsils. Thank you very much.